Dr. Nida with Keys of Health. As the lockdown is being eased around the world, it is important to prepare our bodies, especially our immune system, for a possible exposure to the virus. According to a preliminary study by Queen Elizabeth Hospital Foundation Trust, there is a significant relationship between vitamin D levels and the number of deaths caused by COVID-19. We know that vitamin D plays a very important role in modulating the immune response. It boosts the immune system to fight the infections, and it also protects against excessive immune response called the cytokine storm, which can also cause complications. Vitamin D deficiency is more common than you think. Between the climate, lifestyle, lack of outdoor activities, and diet, most of us just don't get enough vitamin D. And that was before the lockdown. During the lockdown, for many people, this exposure is even more limited. Vitamin D plays some very important roles in our body. It regulates the absorption of calcium and phosphorus. It can boost weight loss. It facilitates normal immune system function. Research has shown that vitamin D might play an important role in regulating mood and warding off depression. This is why during winter, when there is not enough sunlight, people tend to develop depression. Getting a sufficient amount of vitamin D is important for normal growth and development of bones and teeth, as well as improved resistance against diseases and infections. Which is why it is even more important now to make sure we have adequate amounts of vitamin D levels. So how do we know whether we have vitamin D deficiency? You need a blood test to know what your vitamin D levels are. However, there are certain symptoms which can indicate whether you have vitamin D deficiency. This includes getting sick or infected often, fatigue and tiredness, aches and pains, a general sense of not feeling well, unexpected back pain, depression, hair loss, impaired wound healing, severe bone or muscle pain or weakness that may cause difficulty climbing stairs or getting up from the floor or a low chair, or causes you to walk abnormally. Stress fractures, especially in your legs, pelvis, and hips. If you have any of these symptoms, you should check to make sure your vitamin D levels are okay. This brings us to a very important point on how we can increase our vitamin D levels and ensure we don't develop complications even if we contract COVID-19. Most important, sun. You need the sun for so much more than vitamin D. Spend at least 30 minutes in the sun daily. This will greatly help increase your vitamin D levels and improve your overall well-being. Very few foods contain vitamin D naturally. Because of this, some foods are fortified. This means that vitamin D has been added. Foods that contain vitamin D include fatty fish like salmon or sardines. Make sure you always buy wild-caught fish. Cod liver oil is another great source of vitamin D. Egg yolk, shrimp, fortified milk, fortified cereal, fortified yogurt, and some varieties of mushrooms. Sunlight and food is a good way to get vitamin D, but unfortunately a lot of people just don't get enough of it. Research has shown that supplementing vitamin D can reduce the chance of contracting respiratory infections. Since COVID is a respiratory infection, it makes sense to take a vitamin D supplement as we prepare to venture back outdoors. Along with vitamin D, you want to make sure you take vitamin C and zinc supplements as well, since these nutrients are especially great in protection against viral infections. It is important to remember it is not a cure. It improves your overall health and prepares your immune system to have a fair fighting chance. The safe upper intake limit of vitamin D is 5,000 international units daily, and that's what I would recommend, along with 2,000 mg of vitamin C daily and 30 mg of zinc. This should give you a fair chance to fight the viral infections without developing complications. This is really important information. Please share it with your friends and family, and please subscribe to the channel. I'll see you shortly with another video. Until then, take care of yourself. Goodbye.